That light's very bright. That light. Just you good? Okay. Okay. Rightio. Well, thank you for coming, everyone. Today by Professor Ben Cowie, the Acting Chief Health Officer. I've also been joined today by Dr. Neil Coventry, who is Victoria's Chief Psychiatrist, and Dr. Rick Haslam, who is the Director of Mental Health Services at the Royal Children's Hospital here in Melbourne. And if I can begin by running through some of the headline issues of the day and case numbers and a few matters before I hand over to Ben. So there were 176 cases reported yesterday of COVID-19, all locally acquired. 83 of those cases today are linked to known outbreaks, with 93 under investigation, taking us to a total of 1,029 cases in Victoria active at the moment, 1,026 of those being locally acquired and 3 through hotel quarantine. And currently in hospital, we have 61 people with COVID-19 in our healthcare, in our hospitals. 20 of those are in intensive care, of whom 13 are on a ventilator. In regards to vaccines and tests, yesterday there were 33,720 vaccines administered through the state clinics, and that brings us to 2.843 million in the state clinics over the course of that program, together with the other parts of particularly GPs and pharmacists. Now has passed 5 million doses of vaccines for COVID-19 applied in Victoria, which also brings us to more than halfway to our recent 1 million vaccines in 5 weeks target that we launched a few weeks ago. Because we know that vaccines continue to be the way out of this pandemic and the way to gradual easing of the restrictions, and there is no more important thing than either getting tested if you show any signs and getting a vaccine as soon as you can. So please book an appointment. And there were 48,372 COVID-19 tests processed yesterday as well. In regards to the breakdown geographically of the cases reported today, I can report as follows, that 61 of those cases were in the Western Metropolitan Melbourne areas, 67 were in the Northern Metropolitan Suburban areas, 22 to the Eastern and Southern Metro areas, 13 are linked to the Shepparton outbreak. There was 1 in Greater Geelong and 3 under investigation as to their precise origins. And the truth is that, as the Premier indicated yesterday, we have a rising case number, and we all need to be increasingly on high alert to the risks that go with increasing transmission of COVID-19 in our community. We know cases keep emerging, particularly in the northern and western suburbs. Yesterday there were 12 in Fawkner, 7 in Altona North, 7 in Broadmeadows, 7 in Roxburgh Park, and 4 in Truganina. But we're also now starting to see more cases spring up in the eastern and southern suburbs of Melbourne. 22 cases reported today are part of the growing set of concerns that we have in those areas. You might recall that last week and over the weekend we reported wastewater detections in a number of suburbs in those communities. wastewater detects were reported in southern suburbs around Armidale, Paran, South Yarra, Toorak, Windsor in the period between the 25th and the 30th of August. And further in the south, we reported Aspendale Gardens, Bond Beach, Carrum, Chelsea Heights, Edith Vale, Mordialloc, Patterson's Lakes and Seaford over the period the 23rd to the 27th of August. And in the east and in the southeast of metropolitan Melbourne, we've had wastewater detects in Burwood East, Forest Hill, Glen Waverley, Scoresbury, Vermont South, Wantirna South and Wheelers Hill over the period of the 26th to the 30th of August. So really this is a call out, if you're in those particular communities, pay a particular attention to any symptoms that you might have, any arrangements that you've been, keep an eye on the exposure sites which continue to be listed and have now passed over 1,000 exposure sites, and make sure that in those suburbs or any suburbs, that if you show the earliest or even most mildest of symptoms, please come forward and get tested in any of our state testing sites or indeed the Commonwealth's respiratory clinics. It's the most important thing that you can do. So before I hand over to Professor Cowie and then our other guest speakers, I'd also just like to highlight two particular locations that have come in overnight that are of concern to us. The first is the Acquire call centre operations. Acquire run 4 different call centres as commercial providers for many organisations. One of these sites is co-located with Healthcare Australia, which does supply support work to our vaccine program, as indeed it supplies support to the Commonwealth's Healthcare Australia program. There are now 17 cases associated with the call centre at the moment, and they have identified through that approximately 400 primary close contacts. Appropriate testing and quarantine measures are in place, and we are working through the public health response with the provider and indeed making sure that any impact on healthcare services and advice is minimised. Contact tracing is underway, and preliminary advice to this particular workplace is to classify all staff who worked from the 25th of August at the Acquire call centre are classified as primary close contacts, hence the some 400 employees who are now designated primary close contacts. The second relates to the base backpackers in St Kilda. There has been one case identified at the base backpackers in St Kilda, and they have been moved to hotel quarantine. But given the nature of the complex and the shared communal facilities, we are working with our authorised officers and with the residents there now to establish a public health response and ensure that the residents can be quarantined safely. And I might now hand over to Professor Cowie before we hear from Dr. Coventry and Dr. Haslam. Thank you.
Thank you, Minister. So today's numbers and geographic spread show why we need to continue to slow this virus down until as many Victorians are vaccinated as possible, as quickly as possible. And the outbreak of this Delta variant of COVID-19 continues to be focused in younger people. So only 12% of the cases reported today were aged under 50 years. And when we look through all of the 1,029 active cases currently living with COVID-19 in Victoria, looking at that age breakdown, for those aged between 0 and 9 years, there's 192 active cases. Between the ages of 10 and 19, there are 157 cases. 20 to 29 years, 243 cases. And 30 to 39 years, 183 active cases in Victoria. So that means that 3/4 of our active cases are aged under 40 years. And there's a few reasons for that, but one of them clearly is the higher levels of vaccination in older age groups. And it really emphasises the urgent need to get vaccination to every eligible Victorian we possibly can as soon as doses become available. So there's not one corner of metropolitan Melbourne that's not touched by this virus. We have been seeing and continue to see high case numbers in the suburbs to the north and the west of Melbourne. And we're still really concerned by the number of cases and the trends we're seeing in the suburbs of Altona, Broadmeadows and Truganina. But then, as the Minister was just highlighting, today we've seen a significant increase in suburbs throughout the south and east of Melbourne as well. And the only way to keep applying downward pressure on these numbers is for us all to do this together, regardless of where we live. So if someone that any of us knows, anybody in the community, says it's okay to visit friends and extended family because it's just for a short period of time, we have to remind them that this virus is here right now and it's spreading fast. And the increasing case numbers are a herald of what our health system is going to be faced with in the coming weeks and months. Also, some people think that because you're young, if you're young and you're fit, then COVID-19 won't be a problem for you. Young and fit people do catch COVID, and some of them get really sick, and tragically, some of them lose their lives. I myself have looked after people in their 20s and 30s in hospital with COVID-19 through the course of the last year. But even if these people are lucky enough not to get really ill from COVID, every likelihood is that they will be passing it on to their family. In a number of households we've seen in recent weeks, when we test the household of the index, the first case in that household, every single member of that household is infected with COVID when we do the testing. So household transmission is far greater with the Delta variant than even it was with the original COVID-19 strain we encountered last year. And so when these people then go to extended family groups and to other households, they take the COVID with them, and so on and so forth. So thankfully, we're not seeing an ongoing high rate of community transmission in regional Victoria, which is an incredible achievement. There's been no identified onward transmission that we're aware of from the exposures in Echuca and Traralgon. The 13 cases in Greater Shepparton that the Minister highlighted previously are the results of day 13 testing. And again, my thanks and of the whole public health team to those who are doing their isolation, doing their day 13 testing and protecting the community by doing so. So the Shepparton community do continue to do the hard yards of isolating, and the arrival of day 13 testing is great news for many of them. Thousands of tests will be conducted in the coming days, and additional resources have been brought in from the Metro Rapid Response and the Bendigo Rapid Response to support this really huge undertaking. The local public health unit has been in touch with local school communities to plan testing times and to try and spread the testing load throughout the course of the day. So there are thousands of tests to be done, And if someone doesn't get their day 13 test done on day 13, it can be done on day 14. It doesn't trigger an extension to the isolation period or the quarantine period. If it's done on day 14 and it's negative, then that clearance will occur in a timely fashion. So we will be in touch with everybody involved and help them through that process. Can I also thank the over 33,000 Victorians who had a dose of vaccine in Victoria yesterday, in our state system alone. 70% of eligible Victorians vaccinated with their first dose. It gets us to where we want to be. Protecting against the virus, easing some restrictions, and critically, protecting the lives of Victorians and protecting our health system. We know that Victorians of all ages do want to get vaccinated, and Victoria has opened up eligibility to anyone aged from 16 years and over last week. And within 48 hours, hundreds of thousands of appointments were filled by those newly eligible Victorians. So our vaccination hubs are busy and the new drive-through sites are really popular. If you're booked in for an appointment at the Royal Exhibition Building, it's an important point, from next Monday through till the end of September, you'll be notified of a change of venue to the neighbouring Melbourne Museum. The temporary museum site will have the same vaccination capacity, around 2,000 people per day, and will operate for the same hours, 8 a.m. till 4 p.m. And these bookings will be updated automatically in the system. People who have bookings will receive a text message that will provide information on the new location details. And you'll still be vaccinated by the fantastic staff at St Vincent's Hospital who run those sites. This is a temporary relocation to allow for essential heritage work to be undertaken at the Royal Exhibition Building site, and vaccinations will resume there after that work is completed. We may be limited in terms of the Pfizer appointments available in the system at the moment, but it's important to note that there are still over 52,000 available AstraZeneca appointments in the next 2 weeks. Today I can also announce that the dosage interval, so the spacing between the first and the second dose of AstraZeneca vaccine in Victoria, will be revised down from 12 weeks to 6 weeks in all of our state-run services. So that matches the dosage interval for the Pfizer vaccine. So it'll be 6 weeks for AstraZeneca and for Pfizer bookings going forward. And these changes will be active in the booking system from today. So this change and the additional supply of Pfizer vaccine from the Commonwealth when it arrives in Victoria will help us to reach our vaccination targets faster, but more importantly, they will really contribute to the response to community transmission, put a downward pressure on cases, and contribute to protecting our health system as we look after all Victorians. There is nothing more important as we come towards the end of the year than getting vaccinated. The current outbreak in Victoria and the ongoing situation in New South Wales is further evidence of why we need to protect as many Victorians as we can, as quickly as we can. So if you're yet to be vaccinated, please book in your appointment today, either in the state system or with your local general practice or pharmacy. And if you have any questions or concerns, as always, you can talk to your trusted local GP, pharmacist or nurse immuniser or other senior immuniser at our state-run sites also. Now I'd like to hand over to my colleague, Victoria's Chief Psychiatrist, Dr. Neil Coventry. Thank you.
Good morning, everybody. Thank you, Minister. Thank you, Ben. I'm talking to you in my role as Victoria's Chief Psychiatrist, and I want to talk about the impacts on our mental health and our sense of well-being with the midst of the COVID epidemic. It's a very uncertain situation that we find ourselves living within, and I think...
I want you to speak up.
I think, can everyone hear me? I want to make sure that we actually think about the impact that this is having for all of us. It's impacting on our own sense of well-being, our anxiety, our stress level. We're all feeling to some extent confused and obviously very uncertain about the future. I want to really emphasise this is a very normal reaction to a very abnormal situation that we're currently experiencing. But the good news I want to share is that fortunately most of us will be able to cope with this challenge. We'll use our normal resources, our strengths, our sense of resilience and the support that we have around us from our family, loved ones and friends. However, we also need to acknowledge that some people will really struggle, particularly at the moment. Some people are really travelling hard. The people who are really struggling, I really want to emphasise we do have help available. We need to identify the people who are finding this extremely challenging, and we need to reach out. We need to think in our networks, our social networks, our family, our friends, our kids, our colleagues at work, our schoolmates, who might be finding more difficulty and is going to need some extra help, and make sure that we can link them into the help that's available. I want to really focus on a particular vulnerable subset of our community that sometimes we might be in risk of overlooking, and that's our kids and teenagers and their families who are really experiencing some of the impacts on their mental health. So I want to give a few specific messages that I'd like you to take note of. The first message is we need to feel positive, that people will be able to cope with this, that children and families are resilient. They will have the capacity to use their strengths to get through this very challenging situation for the majority. I also want to stress that there are a few simple things that parents can do to try and help their kids in the recovery. Very basic, simple things such as maintaining normal routines. That's particularly important when we've got a situation of homeschooling at the moment, to get that balance between study, relaxing down times, chill out times, certainly exercise and meal plans, but also more importantly around sleep patterns, particularly for our vulnerable teenagers. But the thing I'd most like to stress is that we need to be talking to our kids about how they're coping. Please, please, please reach out to your kids. Don't be anxious and afraid to have the conversations about how are your kids coping, how are they feeling at the moment, what are their challenges and their confusions about what's going on. I'd really stress this is a series of conversations. It's not a one-off, single, intense conversation. Choose your opportunities as a parent when you might be doing an activity with your child where you can have some of those conversations. It's a case of less is more and repeated conversations to explore how your child might be feeling. Do encourage them to ask questions, and as adults try to answer those questions as truthfully as we're able to do. It's really important to acknowledge kids' feelings, to recognise and help them to understand how they can manage these distresses that they're experiencing. The third message I want to get across is that help is available. We have different levels of help that are available for people who are struggling. Do identify the kids and also their parents who might need extra support and extra guidance. On the department website, I want to put some resources that are available. We have many online resources to help both kids and families. We also have telephone services such as Kids Helpline, one of the many excellent telephone counselling services that kids themselves can access. I'll also give some pointers, some advice about what parents and kids can do to look after their own mental health. Particularly if you're really not sure what to do, my advice would be reach out in the first instance to your family doctor. Also reach out to your kids' school, to the teachers, the classroom teacher, the year coordinator, the welfare staff, to try and get advice. Some people are going to need other counselling services, such as Headspace being one of many, and many of those services are available through telehealth, so you may not need to actually appear face to face. The service sector that I represent is the specialist mental health service, the area specialist mental health services and their triage services, which again can be a very useful source to contact, to get advice, and they can triage and work out the level of urgency if you need something more intense. I really want to stress thinking about children and teenagers and their families, because I'm worried that they could be a bit forgotten in this epidemic. I'm also very concerned that we know the research tells us the earlier we can identify problems, the better the outcomes. So we need to make sure we intervene as early as we possibly can. Thank you very much for your attention.
Thank you, Neil, and good morning. At the Royal Children's Hospital, we're witnessing considerable and sustained increases in presentations of children and young people with mental health difficulties. This is on the back of increases in mental health care that have needed to be provided to Victorian children year on year, in excess of the increases for acute health, such as medical and surgical conditions. The sorts of conditions that we're seeing in the Royal Children's Hospital are anxiety, depression, self-harm, suicidal behaviours and eating disorders. We've also seen an increase in young people presenting with aggression, both verbal and physical, and often these are children who might have developmental difficulties such as autism spectrum disorders. This has been the experience of my colleagues across regional Victoria, across other jurisdictions in Australia and in fact internationally. This really notable rise in anxiety and depression taking its way through children and adolescents. The Royal Commission into Victoria's Mental Health Services, which released its final report recently, outlined a number of really important recommendations that will guide future service delivery and will support them in particular. One of these is the introduction of consultations to GPs, paediatricians and other providers such as psychologists in the community. At the Royal Children's Hospital, we introduced a new project which was providing community consultations to GPs, paediatricians and mental health clinicians in the community. And as well, we've been supporting the Head to Help hubs, which have been set up specifically for children, adults and all Victorians who might be struggling with mental health and under COVID. My key message really for parents is that there's excellent information, trusted, reliable information that's available for you. I would direct you in particular to the Royal Children's Hospital website, where you'll find links and resources, podcasts and other information which will support you. What parents really need is to know how to support their children through this time and also how to recognise that their child or adolescent may be struggling. It's really important for parents to check in themselves on how they're coping, how they're managing, so that they can support their family. Parents should reassure their children that their family is their top priority. I think it's important, as I think Neil has said, for families to persist with their routines and with healthy activities such as regular meals, exercise each day, and one of my particular interests, which is ensuring that your children are getting enough sleep. I encourage parents to praise and reward their children when they're doing the sorts of things that they would like to see, and recognise that there will be a degree of demoralisation, worry and perhaps demotivation with regard to things like schoolwork. I'd also finally like to encourage parents to look at ways in which their children and adolescents might be able to help other children, families, neighbours and the community, and think of ways in which they can support others through this difficult time. Thank you very much, and I'll pass you over to Minister Foley.
Thank you, Rick and Neil. Happy to take questions.
Vaccination centres are open up from 8 a.m. till 4 p.m. at the moment. When there's more vaccines that come on hand next month, will those hours extend to perhaps 8 o'clock or midnight? Can we go 24 hours for shift workers?
There's all sorts. So in the main clinics, the big, like the exhibition buildings, that's the current arrangements. There's extended hours at a number of facilities as well, the showgrounds, the industry delivery programs. But as we get more, and as we try to speed up, absolutely. Outreach programs, in-reach programs, expanded hours, some of the arrangements that we're going to have in place for the VCE students they will definitely have dedicated hours which will stretch out the hours. There'll be a whole range of measures all around getting as many people vaccinated as quickly as we possibly can.
Relating to the AstraZeneca, from 12 weeks to 8 weeks, if people have already received an AZ jab, let's say 2 weeks ago, will they be able to get their second one in about 6 weeks' time? And
I'd have to be guided by the clinical experts.
Can we maybe ask Professor Cowie?
You want to ask Ben now?
Yes, please.
Thank you, but I apologise, you'll have to restate the question.
Fine. If someone's already received their AZ vaccination, will they be able to, let's say they received it 2 weeks ago, will they be able to access it in 6 weeks' time?
Yes, so the arrangements that have been putting in with the booking system now is for people who are, so for those bookings going forward, but people will be able to rebook. We've got, as I mentioned, 52,000 slots for AstraZeneca. So for people who are coming due who need to book in earlier than their allotted 12 weeks, we do have capacity to do that. And I'd encourage everybody to do that, because the sooner we have those people fully vaccinated, the better protected against the Delta variant they are.
What kind of an impact does it have on efficacy and also protecting people in the long term when you revise it from 12 to 6?
Yeah, that's an excellent question. So the reason that we had started out with a 12-week spacing was the original clinical trials that were conducted on the AstraZeneca vaccine showed that there was a higher degree of protection at that 12-week spacing compared to people who had less than 6 weeks of spacing. Now, in line with the ATAGI guidance, because we have established community transmission in Melbourne, because the risk of infection is increasing, and because we know with the Delta variant, 2 doses are critically important for getting those high levels of protection. 70% protection against symptomatic illness and 90% protection against severe illness and hospitalisation. It really is important we get those second doses in, and this is in line with the ATAGI guidance.
So it doesn't necessarily reduce the protection, or?
Sure. So in terms of reducing the efficacy, we certainly know that the balance is in favour of shortening the duration at the moment to get the highest levels of protection against the Delta variant right now. We know that coming into the end of this year and into next year, the considerations will be there around booster doses, etc. But for right now, the importance is getting double doses into people right now.
Is the 6 week advice also for GP appointments as well? Just for state clinics?
So this advice is applying to all state services. It's important to note that actually the Therapeutic Goods Administration and the ATAGI guidance has been that you can vaccinate between 4 to 12 week spacing right from the start, back in March when AstraZeneca became available. So it is still perfectly valid in general practice to drop it down even to 4 weeks, but we're recommending 6 weeks to get that balance between optimal efficacy and getting as many doses, second doses into people as we possibly can.
And how quickly will this speed up the fully vaccinated? How quickly will it essentially speed up our vaccination rollout?
So, look, it will certainly speed up achieving those targets, and I think that's an important metric. But for me, a more important metric, honestly, is putting that downward pressure on the outbreak that we're seeing right now. Our vaccine programs are having an effect on transmission. And in part, you see that in the age distribution of the cases, as we were discussing previously. So there is no question that the vaccine program is already helping control this outbreak. But the other thing it's doing is it's protecting our health system and saving lives. And that's the critical reason to get these double doses in.
Is the shortening of that going to minimise the efficacy at all?
So as I was saying previously, it is a balance between the long-term efficacy in the months to come versus getting the highest levels of protection against the Delta variant right now. We know that from the original clinical trials, the efficacy was higher at 12 weeks and more compared to people who had it under 6 weeks, which is part of the reason we're advising 6 weeks in the spacing in the state system. But for someone who's had their first dose of AstraZeneca, with the increasing risk of COVID-19 in our community, getting that second dose, it protects you from symptomatic infection, lifts the protection from around 30% to around 70%. and lifts the protection against serious illness or hospitalisation from around 70% up to above 90%. And it also means you're less likely to pass on, even if you get COVID-19, you're substantially less likely to pass it on to your household, to your loved ones, and to other members of the community. So the risk benefit here is clearly in favour of dropping this interval. It's why New South Wales have done it. It's why ATAGI have recommended this. And it's why our own external advisory group to the vaccination program has recommended this change. And so that's why we're implementing it.
So is it essentially the message to people that have... Sorry, I just want to go on that point. Is it essentially, if you're sitting at 7 weeks, 8 weeks, 9 weeks, go and get your double dose now?
Yeah, so certainly our advice is that in the current situation with community transmission established, the benefit is to get vaccinated after the 6-week mark and not to delay until 12 weeks. It's personal choice. People are really recommended, as always, to discuss with their general practitioner about their own circumstances, discuss with their trusted immunisation provider, but the state system is moving to 6 weeks because it's going to help protect our community and our health system and get us towards those essential targets so we can start moving beyond the situation that we're in.
Do you hope this will encourage what impact that'll have on our ability to reach that 70% mark?
So, I mean, there's lots of modelling going on all the time, absolutely. I mean, it's a fairly simple model to say if we're bringing forward that many vaccinations, we will certainly get to all of those targets quicker. And that's important because those targets are important triggers. The National Cabinet decisions have obviously been made in that space. But I think from a public health perspective, the critical thing is not a faster achievement of the targets, it's faster achievement of protecting the community and ensuring that those people who are fully vaccinated have all those benefits in terms of their risk to others, their risk to themselves and ending up in hospital.
Do you hope that this is going to encourage more people to choose AZ instead of Pfizer, given that one of the reservations is a quicker double dose?
So again, I think the ATAGI advice here is clear as well, that in the setting of established community transmission, it's really important for people to consider their own personal circumstances, to discuss their choice with their GP, their pharmacist, their nurse immuniser, and to consider what's best for them. Now, we have Pfizer eligibility, and Pfizer is still the preferred vaccine as per ATAGI for anyone aged 16 to 59 years, but that choice is there. And if people make that choice in consultation with their healthcare provider, we've got vaccine available now, we've got appointments available now, and if people make that choice, we stand by them and are ready to vaccinate them.
What's the take-up like in the western northern suburbs for AstraZeneca? Do you think there's plenty of space there for people to go out and get jabbed in there as quickly as possible?
So I can't speak specifically to the available appointments for AstraZeneca in the western suburbs or northern suburbs of Melbourne, but what I can say is we've got a lot of appointments across the system, and that's just the state system. Our GPs have got a lot of other appointments that they can fill. They've got doses of AstraZeneca to spare, unlike the situation with Pfizer. So there is no question that whether it's through general practice, primary care, state system, AstraZeneca doses are there and the appointments are available right now.
Could we start getting some daily updates on how we're tracking, what date we're on a trajectory to meeting those 70 and 80% fully vaxxed targets, given that that's basically when we're hoping to be let out of lockdown?
So I certainly I know that those sort of the progress towards those targets is available on the Commonwealth website, and certainly for Victoria there is information on a daily basis on our vaccine uptake and how we're going in terms of those percentages. But if there's particular data items or ways of reporting that would assist the community with getting that understanding, obviously we'd be happy to do that.
If you've got Astra at your GP, should you try and rebook with them sooner, or can you go to a state hub and just get your second jab?
So someone who's vaccinated with their first dose in general practice is more than welcome in our state services, and vice versa, such as myself. I got vaccinated at the repatriation hospital for my first dose and then at a local GP for my second. It doesn't matter where you get vaccinated, it just matters if you get vaccinated.
Given the cases in the eastern suburbs of Melbourne, is this now out of control? Is the lockdown not working or won't actually crush the virus?
As I think was mentioned earlier this week, all of the restrictions and the lockdown and everything people are doing are working hugely. I'm not standing here reporting 5,000 active cases and 300 people in hospital, which is what I would have been doing even under a lower level of public health restrictions, okay? Not zero restrictions, but lighter restrictions. That's what we would be doing today. And I think, as the Premier mentioned earlier this week, 6,000 case difference and hundreds of hospitalisations averted. So what Victorians are doing right now is working. It's saving lives. There are people who would have lost their lives today who haven't because of everything that Victorians have done. But that doesn't mean we can afford to rest on our laurels. Cases are increasing. You know, this is nowhere where any of us want to be. But if it hadn't been for the amazing efforts of the Victorian community, things would be a lot worse, and not just for COVID. If your hospital system is filled with people that we're caring for with COVID-19, a whole lot of the other healthcare we need to deliver has to stop. And that has huge knock-on implications across the community. So no, it is working, but we've all got to stick by it and do our absolute best to keep these numbers down now, because otherwise, with the exponential effect and doubling, we will see thousands more cases come October and November than if we stick to it and do our best right now.
Professor, can you then explain, I suppose, the reasoning behind the sudden jump in cases over 2 days? We're all shocked yesterday, but I think today was even more shocking. So what's the reason behind these cases? Can you explain the jumps? What's the R number? Like, what are we really dealing with here?
Yeah, so look, it is challenging. Can I first of all acknowledge that seeing these sort of numbers is challenging for everyone, and it just adds to that sense of exhaustion that we've been doing so much to try and keep these numbers down. And then seeing the numbers go up can be really demoralising. But I really would point to that point I just made, that were it not for everything we've done and continuing to do, we wouldn't be talking about 100 cases in their hundreds. We'd be talking about cases in their thousands. So why is this happening? There is clearly ongoing transmission in our community. You just have to listen to what the Minister was saying earlier, that some of that transmission is occurring in occupational settings and workplaces, and we need to do everything with industry and with workplaces to ensure that every last COVID-safe principle is being applied, whether that's workforce bubbles, whether that's people not crossing between sites in workplaces, working from home, critical to work from home if you can do that, and really only authorised workers should be out and working, and that's only if they can't work from home. So there's all of that. But we also note that there's significant community transmission between households. And I get that we really are desperate to see our extended family. So am I. So is everybody here today. But right now, that is the worst thing we can do if we're trying to protect our loved ones and look after them and protect our health system, and ultimately get to a point where the vaccination levels push everything down and we can start to safely reconnect and see our loved ones again.
Is the jump to the eastern suburbs because of essential workers, people going into the city and meeting up, or is it people breaking the rules?
So I think the geographic spread is a function of a range of things. I think some of it is occupational. I think there's no question that occupational sites are implicated in some of that. I think spread between households is definitely occurring as well, and that's a tragedy. The last thing anyone wants to see or to think is that they unwittingly have put their loved ones at risk. And it's a horrible, horrible thing for someone to have to reflect on. So please, if you're planning to catch up with family, don't do it now. This is the exact wrong time to do that. The other thing is purely just as a function of the number of cases. As the greater number of active cases in the community, the greater the opportunities for the virus to escape, even if people are doing everything right, which is why we need to push everything down and to keep going as hard as we can, noting that has significant implications on the community. But this is how we all, getting vaccinated and sticking by the directions, and as the Minister was saying earlier, at the slightest sign of illness, please go and get tested. We're still having people waiting a week and getting seriously unwell and turning up to hospital without yet having been diagnosed until they get to hospital. That's terrible for that individual. It's devastating for their family, but it's contributing to ongoing transmission as well.
In terms of health outcomes for those people, how much better off are you if you get tested earlier, diagnosed early? Does that help keep people out of ICU and off ventilators?
There is absolutely no question that early diagnosis lets us give the care to those people that prevents them from ending up in intensive care and from losing their life. So people are enrolled in COVID positive pathways, which were established during the second wave last year. everyone who's diagnosed who's in the community is offered the opportunity to be monitored by their regular GP or by a different general practice. For those who have got more serious illness, they can get referred into our telemedicine and hospital on the home programs. And so they're being monitored. And if their condition starts to deteriorate, we can get them into hospital and give them treatment that keeps them out of intensive care. We've had those treatments available since last year. They've saved the lives of Victorians, and they will be saving the lives of Victorians today, but only if we know that they've got COVID.
So those people you find too late in the picture, or those people you find quite late on when they come to hospital, that's really dangerous for them, isn't it? That's really dangerous for the health system.
Well, and particularly dangerous to them. The later someone comes in, the less we can do to avert that trajectory. The less we can do to try and say, okay, if we intervene now, when someone's just starting to get short of breath, then we can keep them out of ICU, a large proportion of those people, using very simple drugs. We can also treat complications, monitor them, look after them, clearly give them oxygen. Once someone comes into an emergency department who requires a tube put down their throat to breathe immediately, that's it. They're in intensive care and they're usually there for weeks. So yes, you're right, it protects the health system that earlier people present, but more importantly, it saves their life.
Have any cases now been linked to the anti-lockdown protests?
I'm not aware of any cases linked to the anti-lockdown protests.
Can you talk us, one more for Ben, if that's okay, Professor?
It's one for me. Is that okay, Mister?
Can you talk us through the call centre cluster? It's 17 cases. Today's the first time we've heard about it. When did the health department first become aware of a case there, and why? What's the reason behind it ballooning?
Yeah, so these developments are happening very fast. So I've got a little bit of information, and the Minister's clearly already given quite a bit of information as well. Yep, down the bottom. I do have to read though, I apologise.
That's okay, thank you.
So the 4 sites that the Minister mentioned, so we only, I believe, became aware of it from the 1st of September. And we do note, as the Minister was mentioning, that there's a number of cases across staff who worked at various sites across those call centres. The earliest symptom onset, again, as the Minister mentioned, was the 27th of August, which is some days ago. And we believe that that person is most likely to be the index for this particular set of cases. But we are still working through all of that, and contact tracing is ongoing. And again, as the Minister said, that all of the workforce across those sites are being designated in the first instance as primary close contacts.
Is there a reason why call centre staff couldn't be working from home?
Sorry, is there a reason that people... I can't speak to the operational details there.
Yep.
Clearly that'll be part of the ongoing public health follow-up there. And it just comes back to the point that I made earlier that, we really need to stop and rethink about our work practices, not speaking about this call centre in particular, but in every industrial and occupational setting, and think about if people need to be at work or not. But there are many things that have to continue on site, which is why all the other COVID-safe principles are absolutely important, and, might I add, getting vaccinated.
And given that that centre is co-located with vaccination centre staff, is that what the Minister said earlier?
I'm sorry, I didn't hear that.
Yeah. Sorry, maybe we need to talk to the Minister about it.
One more and then back to the Minister?
One
Okay,
more.
thank you.
Hopefully it's very simple. Do you know how many active mystery clusters we have?
So mystery cases or clusters where we don't know the acquisition source. So again, as the numbers of cases increase, I can't give you that answer right now. Our public health teams obviously urgently try and link every single case and cluster to find out where it came from, and ultimately that does occur. But I think it's important to call out, as the case numbers increase, the ability to do that in a timely fashion becomes really difficult. And so it just comes back to that central point. Rather than reporting on new clusters, we'd rather be preventing them. And that's about everyone following the restrictions and getting vaccinated. But I will hand back to the Minister now, if that's okay.
Thanks, Beth.
So, Minister, on the call centre case, on the call centre, as Rachel said, why aren't they working from home?
Well, there are many different arrangements in place across the industrial and communications landscape, where different facilities have different arrangements to their COVID-safe plans. And as Ben indicated, this particular service, as I understand it, has a range of contracts with a range of different service providers, governments at different levels, private sector, a whole range of things. Insofar as its particular COVID-safe plan, I'm not particularly briefed, but I do understand that that's part of its arrangements.
Are they doing COVID hotline work? Are they doing COVID hotline work?
I don't think they're doing the COVID hotline work specifically. As I'm briefed, I think they're doing bits of some of the vaccination support. They're doing some support for Healthcare Australia, which amongst other things has a national contract with the federal government about, I think, aged care, private residential aged care in region support, and a range of those kind of functions.
Is that booking vaccine support? Is that booking? Is that booking the vaccines?
I'm not sure if it's booking the vaccines. I think that's mostly online and through other parts of the call centre. As I'm advised, and this is evolving, it's the support and questions associated with it.
I wanted to ask you about the public health system. The Royal Melbourne Hospital has activated its pandemic mode with only a small number of COVID patients. Will our hospitals be ready for when we open up, considering the Royal Melbourne's already had to activate that mode with a small number?
So since this particular outbreak started on the 4th of August, we've seen the Royal Melbourne Hospital, we've seen Western Health, we've seen the Children's, we've seen Goulburn Valley Health, we've seen a whole range of hospitals impacted as they've moved up their settings to operate in a more COVID-safe environment. The Royal Melbourne has had its own cluster, which it's been quite some days now since they've had additional cases. So I want to congratulate the team at the RMH for seemingly bringing that under control. In regards to the wider issue of more cases having an impact on our healthcare system, of course they do. And in that regard, I note and support the comments that the AMA have made today, that we are facing a choice here about whether we open up too quickly and too readily and put so much pressure on our healthcare system nationally that that healthcare system won't be able to cope. We need to support our healthcare professionals by keeping our hospitals functioning in a COVID-safe way, and that means getting vaccinated, pushing down these numbers and following the rules of the public health team.
And Minister, on a different topic, on Tuesday night there was a dramatic policy shift. Was that a particularly sobering, night for you? Did it take you by surprise?
Of course. When the public health policy advice changes, in fact, it was very sobering. That's an excellent way to describe it. But you've got to follow the advice and the science. Delta has changed the script. And despite the enormous efforts of Victorians to keep these numbers down to the level they have, and as the Burnett Institute pointed to yesterday, saving some 6,000 cases alone over the past month, and who knows how many that would have exponentially grown to over coming weeks, those measures were valuable. But when you have to follow the science and follow the advice, that is a really significant moment, a point of pivot of how this pandemic has changed. And all Victorians, I'm sure, were equally sobered by that news. But what we can do as a community is take the public health advice, pursue the vaccination programs really, really hard, and continue to follow the public health advice to protect our healthcare system.
Given that shift, is it given that shift, is it time to reconsider or reassess whether we should be using rapid antigen testing for high-risk workplaces, given that there's an acceptance that COVID will continue to be seen in the community?
Did you say that last?
Rapid antigen testing in high-risk workplaces.
So, of course, as part of the program, as the TGA and the federal regulatory bodies increasingly move down the path of how we serial test in high-risk industries, rapid antigen testing, saliva testing, all sorts of other measures will increasingly become a part of how we respond. It's already the case in hotel quarantine, in a number of our hospitals, and we've well progressed in discussions. In fact, some are being implemented about rolling that out in some of the high-risk industries now. Employers rightly, and their workforce rightly, want to make sure they can do everything they can to stay ahead of where the transmission of the virus is occurring, and rapid antigen testing, saliva testing, other forms of testing are a part of that. They're not the gold standard of PCR testing, but they are an indicator, if used consistently and as the technology improves, part of the public health response. So it's already there. I think what we'll see is it will rise in its use and its efficacy.
The Prime Minister last night, he had mentioned that he was going to speak to the PM about, I guess, what restrictions could potentially ease once we hit 70% double dose. Do you have any further information on what that conversation?
No, the Premier and the Prime Minister's discussions is informed by a whole range of work that the National Cabinet is doing, led by the Commonwealth, and I'll let the National Cabinet processes play out.
Can we maybe ask Dr. Coventry?
Do you know when Victorians stuck on the New South Wales border might have some insight on when they can come back in?
Look, there's a number of Victorians, whether along the border or in New South Wales, who have applied to come back to Victoria. We've processed thousands of applications with the priority being urgent medical care, end-of-life visits, family who need to come for funerals and those kind of things. And I apologise to all of those Victorians who are still wanting to come home, having their applications at this stage either declined or still being processed. Ultimately, we have to get all of those people home, but we have to get them home safely. And given the demand of people who want to come from the extreme risk zone from New South Wales into Victoria, we have to do that, each case determined on its merits. And there are some heartbreaking cases, but we're getting our way through them, and we will get these Victorians home.
Just on contact tracing, we had 71 exposure sites listed in the 24 hours to today. That compares with 147 on Tuesday, and that's just despite the very significant number of cases we've experienced in the last 2 days. Are our contact tracers getting overwhelmed?
I don't think they're getting overwhelmed, Rachel, but clearly as cases go up, demand goes up on the entire public health response. Our frontline AMBOs, our EDs, our nurses, as well as our contact tracers. They're doing an outstanding job. The reinvention of this state's contact tracing system over the course of the last 18 months has been a real feature of our response. But of course, when you're dealing with 170 cases as opposed to 7 cases a day, the demands go up. But I wouldn't describe it that way.
We're having some reports of people who have visited exposure sites and checked in, but are only being notified via the QR code app or the texting system, whatever you use, 4 days after the site went up online. Is that an indication of the stress, or is that just an anomaly?
Well, I don't know the specific cases that you're referring to, and there might be a whole range of reasons as to why that is the case. But the QR code system is a critical part of the contact tracing toolkit, and I think Victorians have taken to it because they know it's that critical tool in alerting them early. I'm happy to follow up any specific examples.
But do you hear about instances like that, or is that news to you?
Well, I hear all sorts of assertions and all sorts of measures, but clearly, as numbers go up, demand pressures go up. But I'm not aware of that particular circumstance.
Do you want to go?
We'll get the chief psychiatrist. Yeah.
On Shepparton, given the successes that you're seeing with kind of bringing that under control, will that become a bit of a blueprint for handling future regional outbreaks if they occur?
Every outbreak is a learning experience for our public health and local public health units. What Shepparton showed about this time last year actually, as well as this year. Not out of it yet, with the day 13 tests showing more positive cases, which is sadly not unexpected. But Shepparton, as a diverse, multicultural, strong community with strong social links and connections, has shown itself to be a bit of a model in how it goes about these things. And yes, all outbreaks are learning experiences, but from a regional community's point of view, what happened 2 months ago in Mildura and what's happening today in Shepparton are very much models of what strong community responses can achieve.
What happens for people that have previously been going the other way for, say, cancer treatment? What do they do in that case instead of going to Melbourne?
Going the other way.
So they're going into New South Wales?
Well, we don't control which way. So the border permits are through the border bubble this way. So if you're in Wodonga and you want treatment in Albury, well, you're still covered by the medical treatment provisions of the border bubble arrangements.
Dr. Haslam, do you mind if we just ask you, you mentioned a notable increase in anxiety and depression for younger kids. Can you just quantify that? What sort of increase are we seeing?
So what I can tell you is that children and adolescents presenting to the RCH emergency department have increased between 30 and 80% on relative to the previous year. That's just emergency department presentations. Of course, there's many other young people who are presenting to other providers and also our community mental health teams.
What are they telling you is the reason behind their anxiety? When you speak to these patients, what is causing this?
Look, there's a range of things. I mean, there's a sort of a tidal increase of demoralisation, of anxiety, of worry, of irritability and frustration. All these things I think we can all sort of experience and recognise. I think my answer to that would be that there are probably children and adolescents who have perhaps fewer supports or perhaps more vulnerable for one reason or another. Those children and adolescents are much more likely and prone to develop anxiety and depression. But we also have to remember that these are very common conditions, particularly in adolescence.
But you mentioned, sorry, I was just going to say, you mentioned in terms of advice, a lot of routine was the advice to parents. So how much of an impact has the loss of face-to-face learning had on the numbers you're seeing?
Yeah, it's inordinately difficult to tell. I mean, I think there have been rises in anxiety and depression in jurisdictions where there haven't been, for example, school closures. It's very hard to tell how much that's a factor. I mean, clearly it is a factor. There's actually some children who've, to some extent, experienced a reduction in anxiety from studying from home, but that's obviously not the majority.
How susceptible are children and adolescents to, I guess, everything that's happening in the world, the news? There's some pretty sobering stories over the last 2 years. Does that weigh on them as time goes on? Is that part of what it contributes to this problem?
Look, I think it probably does. As young people get older, their world gets bigger. It's probably little kids aren't so aware and interested in what's going on with, climate change or wider issues in the world. But yeah, I think particularly nowadays, young people are much more in tune with world events and these sorts of concerns. Yeah, I'm sure that that's a factor. Difficult to tell how much though.
How much does, I guess, things like playgrounds, physical exercise help in mitigating some of those problems?
Yeah, well, my colleagues at the Children's and the Murdoch Children's Research Institute have looked into this, and there have been a number of surveys as well, of course. I think being able to exercise, being able to go to playgrounds is obviously important for children's mental health, and the decisions that have to be made by my public health colleagues in relation to closures of things like playgrounds are inordinately difficult decisions to make.
A date, like a fixed date for children to work towards when classroom learning returns, would that help with anxiety and depression?
I'm not sure. I mean, I think for most of us, we're as a parent myself, we want to say to our kids, look, you'll have your birthday party, but we actually can't promise those sort of things. So I think it can be a bit dangerous to give a date when we don't know that we have a date.
I guess, how involved are you with the public health decisions regarding restrictions and lockdowns?
Yes, that's a good question. Basically, the public health Chief Health Officer who has to make these difficult decisions has a wealth of expert information to weigh up the balance of physical and emotional health. So I'm one of many experts, as is Rick, other people from the field, who provide a wealth of information not only to the Chief Health Officer but also to the government in making this difficult decision. So I'm very confident that certainly there's sufficient input in terms of the mental health consequences and impact.
And this is obviously our sixth lockdown. It's weighed heavily on a lot of people. What was your advice in relation to this particular lockdown and also the extension of the restrictions as well?
I don't get involved in making the decision about the lockdown. That's a public health decision. So clearly I don't get involved, but certainly look at the impact that it's going to have and also the preparation. As Rick and others were saying, we can sort of anticipate some of the impact this is going to have and try to be ready for that, but it is unpredictable, as everybody knows, and we need to keep our community as safe as possible.
And there's been a lot of debate and discussion essentially around whether the cure is worse than the disease, for a lack of a better phrasing. What's your response to that, and do you share those sentiments?
Oh goodness, that's a $1 million question, isn't it? I suppose taking a very pragmatic view, I would hate to think that children's mental health is suffering because their parents who need to care for them are in hospital or even worse, die. That's a terrible tragedy for any family. So these are always very difficult decisions to be weighing up, but we need to see how connected our physical health is and well-being with our mental health and well-being making these decisions.
Are you consulted every time new restrictions are about to be imposed?
I'm continually providing advice to the public health department and officer, so not only when restrictions are being considered or lockdowns, but continually, every day, every week, the data analysis.
Victoria admitted yesterday that you don't have a seat at the table when it comes to those crisis meetings. Do you think that you should?
No, I don't think I should. I think that would be contaminating the process. I'm very confident that the information that I give, my own expertise and the expertise that I bring from contact with the field is being adequately considered for the people who have to make those tough decisions.
Have we struck the right balance between public health and protecting the mental health of young people given the measures we have in place at the moment?
I think it's always a balance in making these tough decisions. It's very difficult, as you can imagine, and they weigh up an enormous amount of information. These aren't hasty decisions that get made, but in terms of being the chief psychiatrist, I'm very confident the mental health aspects are given the appropriate weighting.
Resourcing, does the system have enough capability, I guess, for the stress it's under at the moment?
The system has always been under-resourced, unfortunately, and I guess we are to some degree fortunate that the Royal Commission finished just prior to the situation with COVID. So there's, as you know, there's enormous reform going on, enormous increases in resource, certainly increase in resource in the child and adolescent and family area. So I think that's a nice synergy when we actually need it the most at the moment.
Professor Sutton mentioned yesterday that 3 weeks to get to maybe 70% first dose vaccinated can feel like an eternity. There's no light at the end of the tunnel. When you were hearing that messaging and the realisation that we are going to be in lockdown likely until the end of October, maybe longer, what effect have you perceived that having on Victorians just in the past 24 hours?
Oh, it would be very difficult to say. I think all of us are in a bit of a state of shock. The message I'd want to give to parents really is think about the age of your child, your kid or your teenager, what they're able to understand. Try to be honest and open and truthful as you can. Certainly try to understand and talk to your kid. These are things I don't think we can give sort of trite answers about reassurance. It's really understanding. For every child it's going to be different and their level of understanding is going to be different. But as adults we need to manage that.
If there's any one reasonable thing you might be able to recommend to the government once we hit that 70% first dose target in a couple of weeks' time, is there any one measure, whether it's to deal with isolation or otherwise, that you feel may assist Victorians' mental health in particular?
I don't think there's any one particular factor, unfortunately. This is very complicated and these are multifactorial. So I'm confident that all of these things get considered. Clearly, schooling is very important for people. We've got to do that in a safe way, but we've also got to recognise the socialisation that happens with children, particularly just thinking about the situation with playgrounds. I was very pleased with the directions with playgrounds, but I just want to hope that everybody follows the rules so that we don't have super spreader events, because like Rick was saying as well, playgrounds are very important for children's emotional and social and physical development as well. So we want to make sure that we behave the rules so that children can have access to that.
There's a lot being said, and I want to be careful about how we talk about this, about the suicide rate at the moment.
Yes.
The overall suicide rate, my understanding, is about the same or less, but we're seeing it peak in different age groups where it wouldn't normally. Can you explain any of that or why it's happening?
I wish I could give a simple answer to that, but the first thing I would want to say is any suicide is a tragedy, particularly in a young person. There's always loved ones, family, friends that are in school that is impacted. So personally, I think we should always be thinking we're aiming for zero suicide for every age group. The message I want to give out is that for reasons I guess we don't know completely, the suicide rate hasn't gone up in the way we predicted and hasn't gone up for young people. That doesn't mean we need to be complacent. My message is I would hate us to focus on just the suicide rate and think, oh, that's okay, young people aren't suffering mental health problems. As we've just heard from myself and Dr. Rick Haslam, anxiety, depression, self-harm, etc. is really concerning, and we know there's been a trend very much predating COVID of an increase in problems with mental health and well-being for young people that we're now recognising. So this was predating the COVID epidemic. So I think we need to take a very broad approach. I would hate us just to focus on suicide and be thinking if the rate hasn't gone up, wow, we don't have to do very much, because we do.
And can you talk to us about the way suicides are reported and the impacts that has on the public and the wider impacts of suicide itself? We're seeing a lot of information being thrown out from all different types of people. How should that be controlled?
That's a good question. Difficult to give a simple answer for that. One thing I would say is that suicide in children and young people, fortunately, is still a fairly rare event. Because of that, we have to be very careful in the reporting. I'm sure as journalists you know about the risk of cluster suicides when people copy mode that's happened. So as journalists, there's a code of ethics about how you report that. We also have to be very careful about confidentiality. When you're talking about small numbers, there can be a risk that you can actually identify without meaning to, and we have to be very respectful of families who are suffering. So it's not an easy answer about the way to be thinking about this in a safe way, because we want to improve what we're doing. We actually don't want to run the risk of aggravating, which is a considerable risk.
Yourself and Dr. Haslam has given a lot of advice to parents on how they can support their children and also adolescents as well. But as Dr. Haslam mentioned, there are a lot of vulnerable people, a lot of vulnerable children who might come from very disadvantaged backgrounds, who have mental health issues. How do we support them, and what kind of, because both lockdowns and the disease will probably disproportionately affect them. How do we reach out to them, and how do we support those kids?
Again, a very good question, and that is a concern, because that group can be particularly vulnerable because of their past history, where they might have come from, if they've come as refugees or have come from overseas with warfare. The main message I suppose I'd want to give is that we need to do this in partnership. We need to have cultural and linguistic sensitivity. We need to make sure we're reaching out and giving information in the language that's appropriate. And we also need to deliver the services in partnership with community cultural organisations and take their advice, because the traditional approach may not be something that's acceptable to people from cultural minorities. So we've always got to take our advice from our experts who work with the community groups, who can tell us the way we might need to adapt the services that we provide.
From a contact tracing and a public health COVID point of view, there's been a lot of outreach to, as you say, these community and cultural groups. From a mental health point of view, has there been an increased shift in trying to reach out to community groups to support them with mental health issues?
Look, my observation is yes. If we think back to the concerns we had last year with public housing and the lockdowns that happened and how we've managed that now, I think everybody has learned a lot more about the cultural sensitivity, particularly when many of those communities in public housing where the outbreaks were occurring were in minorities who didn't speak English, who had particular backgrounds of trauma that needed to be done sensitively. So I think we've learnt a lot, and I think we manage that in a much more culturally sensitive way. We always need to improve, but I think we've taken advice from our experts who work with cultural groups and linguistically diverse groups to make sure we do this in a better way.
Professor?
We can all do, every one of us, what can we watch out for to know if a friend or loved one might be struggling at the moment? What are some of the warning signs?
Oh goodness, I'll be putting this on the website, but perhaps if I just answer that question thinking about children, as you can understand, for children to come to attention, there needs to be a caring adult around them. Generally, teenagers might be able to access services in some cases, but children will need an adult, a parent or a carer to help. In a very simple way, what I'd like to stress is that I think we are all aware of the children who are quite disruptive and distressed in their behaviour, and they're showing it with their behaviour, so they're very visible. The ones that concern me are the children who become more withdrawn, who become quiet, who can slip under the radar and don't get picked up. They are just as worrying. So we need to reach out to both those groups. Don't think because the child isn't showing terrible behaviour that means they're okay. We can have very quiet children who seemingly are doing their homework but in fact are really struggling with this. So simple answer to a complex question is focus not only on the children with what we call externalising outward behaviours, but the kids who are becoming very withdrawn and quiet. They may be even more at risk.
Professor, we've made a lot of surveys that show that some of the Victorian community are more concerned with the mental health impacts than COVID-19. Are we overstating the mental health impact compared to the virus, given that you seem quite confident that our kids in particular are quite resilient and they will rebound on the other side of this?
Look, I would never be confident that we're doing enough to help people who are vulnerable, and we had people who were vulnerable well before COVID as well. I think we need to look in a holistic way at physical and mental health. As I was saying before, a bit trite, but if we have parents who are in hospital, that's certainly going to impact on their children's mental health and well-being. So it's always a balance to try and look at how we best manage this. My job is to make sure I'm giving the right advice to the people who have to make these tough decisions, but also I think we've got a lot of evidence now about what might be some of the effects and what are the best ways to reach out. As an example, you might think intuitively that young people would engage very well with telehealth. That doesn't seem to be the case for some young people who really want a face-to-face contact. So part of my work with the specialist mental health services is to encourage a mixture of both face-to-face assessments and also telehealth, so we can match it to what might be appropriate for the young person and what their requirements and wishes are.
Thank you, gentlemen. Really appreciate that.
Thank you.